Public satisfaction with the National Healthcare Service hits a record low. I'm going to read into this more from the BBC, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an article from the BBC with a headline that public satisfaction with the National Healthcare Service hits a record low. It says public satisfaction with the NHS has hit a new low according to a long-running British social attitudes survey. Guys, while you're here, make sure you hit that like button and share across social media so others are notified of this video. So, obviously, this is from a survey. Like I say with surveys and polls, I do take them with a pinch of salt, even no matter how reliable they are, because it's a perception of what a group of people who participated in their opinion polls at the time of what they think of the National Healthcare Service. I wouldn't say it's a fair reflection on what everyone feels of it, but obviously it is something that perhaps we could take on. That's something that we could take on board and something to look back on. That perhaps maybe that is the indication of what the National Healthcare Service is. It's also important to point out a couple of things as well before we read into this as well. Is that first and foremost is that our National Healthcare Service. I want to speak particularly in England, of course, although other NHSs have been doing poorly. Wales, Scotland. Wales has been a lot worse. Scotland performing a lot better, has been performing over the last 14 years under the Conservatives, a lot better with England and Wales combined. Can't really speak too much on Northern Ireland personally on that, but all our National Healthcare Service as a whole has done poorly over the last 14 years under the Conservatives. The Conservatives ripped apart funding from it and choked the life out of our healthcare service to try and push us towards more privatisation, to push people towards more private healthcare rather than using the National Healthcare Service. Now, obviously, we don't know as of right now whether the NHS is going to what's going to become under West Streeting over the next couple of years. We do know is that waiting lists have gone down. This has been recorded. They have been reducing NHS waiting lists overall, which is a good thing because we do want to see people being able to get their tendencies. There is still a lot of work to do because it's easy to tear something down. It's much harder to build things back up. And while I have criticisms about West Streeting, the Health Secretary, and I'm sure many people who watch my videos are too, we also have to be understandable that it takes time for change to take place, in particular with the National Healthcare Service. So while I am critical of West Streeting, I'm prepared to see at least to the end of 2025 to see what has been done since this government has come into power. Because if there are signs, and this is the first time that there has been reduction of NHS waiting lists. However, as we see here, public satisfaction is still recorded low. But will that still be the case come the end of the year, according to some polls and opinions? Maybe it will, maybe it won't, but time will tell. And obviously, they still have a couple of years in power, of course, as well, so we do also have to bear that in mind. So we do have to have a certain degree of patience. And I know some people are frustrated with the NHS. I know people are frustrated that not everybody in certain different parts of areas and regions, because it's different rates. Not like in London, it's much easier to get a doctor's appointment. Let's be serious, okay? I live in London. I know I can get a doctor's appointment if I wanted to. Yeah, but for someone who lives in a rural area or whatnot, it's very, very difficult to get a doctor's appointment. It's almost impossible for some people to get an NHS dentist appointment without paying, like, I don't know, 200 quid just to see a dentist, like, because you have to go private to get your teeth checked. Yeah, it's almost impossible to get NHS dentistry, but they are looking to roll some of that back in the Labour government, but that's a different story there. But we have to wait and see how things go, and so far the indication seems that things seem to be going in the right direction. Seen. But we'll have to wait and see on that, guys. So let's have a read into this. So, public satisfaction with the National Healthcare Service has hit a new low according to a long-running British social attitude survey. Just 21% said they were satisfied with the NHS in 2024, with waiting times and staff shortages the biggest concern. Satisfaction rates have dropped sharply since the pandemic. In 2019, 60% were satisfied. Now, again, it's important to stress on this year number here. So, up till July, the Conservative government were in charge of our National Healthcare Service, and from July to the end of that year, the Labour government took over and they were in charge of our National Healthcare Service. It's also important to stress that between July and the end of the year, there is only so much that Labour can do when something has been broken and been damaged to a certain extent, then they're not sure how that there's no quick fixes. So I don't think it's right or it's fair to say that Labour should have fixed things by the end of 2024. Like, that's just nonsense. Like, we know how much damage the Conservatives have left the healthcare system in. So I don't think it's right to blame the Labour government on this entirely. I would say that if this is worse or the same in this year, in 2025, once they do this survey, if it's the exact same, around the same percentages, or worse, then you can definitely say, there's definitely some questions that need to be raised here. And I think that would be a much fairer attack to make on Labour. Satisfaction rates have dropped sharply since the pandemic. In 2019, 60% were satisfied. Responding to the findings, Sir Jim Mackey, the new Chief Executive of the NHS England, said he was worried about the growing disconnect between the service and the population. The poll, the goal-running standard of the public's view of the health service, has been running since 1983. Nearly 3,000 people from England, Wales, Scotland were asked for their views last autumn. Yeah, 3,000 people. Obviously, that's a decent amount of people to convey on this. But again, that's not everybody's opinion on the NHS as well. So this one here, this is the first one here. So this is public satisfaction with the NHS at a record low percentage of the survey respondents saying they were quite or very satisfied with the NHS in Britain between 1983 and 2024 here. So you can see the chart here from 1984 all the way to 2024 there. And we can see here that although it's not been completely filled in, but you can see that but all the way up till 2010, I would say roughly about 2010 was when it was at its peak highest rating. And we can see there that since then, although there was a bit of a high dip, a bit of a rise again in 2015, 2016, there was a dip and rise, but it started to drop, And then obviously that last point there before it dipped, obviously I would say that would be around the COVID-19. The COVID-19 obviously era, because obviously we needed to give as much love as we could to NHS, but since then it has fallen because people are not because we haven't really, the NHS hasn't fully, as I say, they haven't recovered from COVID because the funding's hasn't been there for COVID. So I think that's a fair thing there. It says that a methodology change there for the grey slot there. It also notes that since 2020 the survey has largely moved online. The impact on the result is judged to be minimal. Data not collected for every year there. So again, that's why I said to take it with a pinch of salt. So there have been particularly sharp falls in satisfaction with free core services. 19% have been satisfied with A&E compared to 54% in 2019. 20% were satisfied with dentistry compared to 60% in 2019. 31% were satisfied with GP services compared to 68% in 2019. Yeah, dentistry has gotten a lot worse. I haven't had a dentist appointment for quite a long time. I am registered. I'm on a waiting list right now for NHS dentistry, and I'm still waiting for response. Luckily, for me personally, I'm very lucky that I had my teeth taken care of when I was younger. My parents made sure that I had really good teeth. I wore braces for a number of years, and for long periods I've been able to have dentistry. Unfortunately, during COVID, I lost contact with my dentistry during that period, and I wasn't able to move at the time. So, but since then, that was when I had my last dentist appointment. That's really, really bad, obviously, for me. But I'm not prepared to pay the cost that it is for private dentistry. Me personally, like, I'm in a situation where my teeth are pretty good, and as long as I continue to brush them, look after them, I'm okay. But obviously, some people are in desperate emergency need. That's the big one. Well, that's definitely one of the bigger problems there. A&E accident emergency has obviously been in a lot of problems as well, as we've heard some stories, obviously, as well. So hopefully that will improve. This is one that definitely needs to improve, especially when people's lives are at stake there. And obviously, being able to get to a doctor's appointment, like I said, reductions in waiting times is definitely a step in the right direction on that. The public in Wales were the most dissatisfied with the NHS, so that's not surprising. Satisfaction with social care, which covers care homes and helping the same home, was lower still, with just 13% saying they were satisfied, the same as last year. So Jim, in his first broadcast interview since starting his new role, said, "None of us has felt we are delivering improvements at the pace needed for our population. I'm very worried about the growing disconnect between the service and the population. These results are pretty bad, and there is a big message in that. We are here for the population. The population owe the NHS. It's their service. James Culligan, 41, from Luton, is someone who has become frustrated with the state of the GP care. He said he has struggled to get an appointment when he needs one for himself or his children. His 11-year-old son suffers with allergies. They consistently tell you to phone back every morning at 8 a.m. to see if there's an appointment available, and they generally never are. He said they has resorted to visiting local walk-in centres or phoning NHS 111. I can understand people's opinion of the NHS dropping, he added. Susan Quimby told the BBC about what she described as a horrific ordeal after being taken to the hospital in what turned out to be sepsis. This is a 68-year-old from York went to A&E because of wounds that had been gradually getting worse and spent 17 hours in A&E before being taken to a ward. 17 hours. This is a massive problem. This is people being forced to wait. I waited in A&E with oozing weeping, open sores, and on both shins. I had to ask a nurse in A&E for somewhere to lie down, so I felt terribly ill with chills and a fever. Once in the bed, it was confirmed that I had sepsis at a very high infection rate. Spent 8 days in the hospital in an antibiotic drip. While I was there, my bed sheets were changed once a week. My legs wouldn't stop oozing, so the sheets were filthy. I was worried about picking up another infection. The survey, which was carried out last year, but before last year's budget, when the government announced its rise in funding, also found that 2/3 did not think enough was spent on the NHS. It'll be interesting to see what the people think now. But the public is also concerned about the waste, with just 14% saying the NHS spends its money and has efficiency. B. Taylor from the Nutfield Trust think tank, which has published the findings along with the King's Fund, says that just 5 years after the British public were calling on to protect the NHS at the start of the pandemic, these findings reveal just how dismayed that they are about the state of the NHS. By the way, this is exactly what the Conservatives wanted. They want, and especially private healthcare companies, they want us to hate the NHS so that they can turn us to push us towards buying for health insurance instead. The government says the NHS is broken, and the public agree, but support for the core principles of the NHS, free at the point of use, is available to all and funded by taxation, ensuring despite the collapse in satisfaction. Louise Arency of the Patients Watchdog Health Watch England said the survey was a sobering reminder of the state of the NHS. Although many people will tell us that they are grateful for the hard work of the NHS staff, long waiting times and access issues across the health system have taken their toll on people's confidence in getting timely care in the first place. And Saffron Corley, Interim Chief Executive of the NHS Providers, which represents health managers, said that these figures must be a wake-up call for the NHS. There is a clear radical action that is needed across the board to restore public faith in the NHS. England's Health Secretary Wes Streeting said, "We inherited a broken NHS and this survey shows patients agree." He said that since the survey was carried out, extra money has been invested and improvements have started to be seen, but it would take time. Yeah, this is exactly what I said. It's going to take time. He said the forthcoming 10-year plan for the NHS, which is expected in the summer, will once again make the NHS the envy of the world. Well, it'll be interesting to see what this 10-year plan is, and will it be foiled by whatever political party will take over at some point in the future, because Labour will not be in power forever. We all agree with that. We don't even know if they're if they're a shoehorn in to win the next general election. People will go on and on about, but the Conservatives are bad, they're bad. Well, if people feel that they're not better off, they will vote Conservative. If they think they are better, or they'll vote Reform, because some people have a short-term memory about what's happened over the last 14 years under the Conservatives as well. People generally are impatient. And there are also people who pay no interest in politics whatsoever and just think that if their lives ain't getting better, they're going to blame the current government. It's always the current regime. This is where the judge will be made. And it's important also to remember that people voted Labour because they wanted the Conservatives gone, not because they wanted a Labour government. And the vast majority voted for them because they were tired of the Conservatives. But that does not mean that people are going to vote for them again at the next general election. But what do you guys make of this? Do you agree that the NHS satisfaction is very low right now? Do you think that Wes Streeting and this government are going to turn it around? Let me know your thoughts and more on this story down in the comment section below. If you found this video informative or helpful to you, please hit that like button. We greatly appreciate it. Share this across social media so others are notified of this video. Subscribe if you haven't already. Do check out the Patreon and Rumble channels as well for exclusive content on them. And if you want to financially support me, click the join button down below to join the YouTube membership for as little as 99p. Thank you all so much for watching, and I hope to catch you all very, very soon.